What is direct primary care, and why should I care? What are the benefits of the DPC model for patients and for physicians? How do you negotiate wholesale prices on labs and medications? Learn the answers to these questions and many more on this episode of the Talk to Me Doc podcast.
Welcome to the Talk to Me Doc podcast, where it's all about serving the early career physician. Let's talk about the unique issues that face us so we can create a better future for ourselves and those to come. And now your host, Dr. Andrew Tisser.
Hey guys, it's Andrew. Welcome back to the Talk to Me Doc podcast. I am so happy that you're here. For my returning listeners, thank you for your continued support. For my new listeners, welcome, because today, like on every episode, you're going to get the best guests from all around healthcare and beyond to talk about issues relating to the early career physician. The direct primary care model has really started to gain some traction over the years, and we are hearing more and more about this type of unique practice model. Dr. Paul Thomas is a board-certified family physician practicing in Corktown, Detroit. His practice is Plum Health DPC, a direct primary care service that is the first of its kind in Detroit and Wayne County. His mission is to deliver affordable, accessible healthcare services in Detroit and beyond. He has been featured on WDIV-TV Channel 4, WXYZ Channel 7, Crain's Detroit Business, and CBS Radio. He has been a speaker at TEDxDetroit. He is a graduate of a Wayne State University School of Medicine and now a clinical assistant professor. Finally, he is an author of 2 books, Direct Primary Care, The Cure for Our Broken Healthcare System, and Startup DPC, How to Start and Grow Your Direct Primary Care Practice. Well, I really want to hear some more about how he does what he does, so let's get Dr. Thomas on the show. Dr. Paul Thomas, welcome to the Talk to Me Doc podcast.
Thanks so much for having me on today. It's great to be here, Andrew.
Yeah, thank you. So I've already recorded a little bio about you, but for the listeners, could you tell everybody who you are and what you do?
Sure thing. My name's Dr. Paul Thomas. I'm a family medicine physician, and I started a company called Plum Health, and our mission is to make healthcare affordable and accessible here in Detroit and beyond.
Awesome. So I had you on the show to talk a little bit about some concept that's been getting some traction lately called direct primary care. Could you talk a little bit about it, what it is, and what your story was to get you into it?
Yeah, sure. Let's start with what direct primary care is. And direct primary care is a membership model for healthcare. So my patients pay about $50 a month if they're under 40 and about $70 a month if they're over 40 to be a part of my practice. And when they're a member of my practice, they can call me or text me or email me anytime. And I guarantee a same day or next day appointment. And as a contrast to the fee-for-service system, I don't bill or use insurance at all. And so I'm trying to lower the cost of care for my patients by getting medications at wholesale prices and giving those to my patients at those wholesale prices, and doing the same thing for lab work and imaging services. And beyond that, my patients have the assurance that they can get a hold of me whenever they need to. So that's direct primary care in a nutshell. Sometimes we get confused with concierge medicine, but we're not concierge medicine. We may deliver a similar kind of service in that people can call us or text us and have a same day or next day appointment, but we don't bill insurance like concierge medicine doctors do. And then the amount of money that people spend on direct primary care is far less. The average cost for a DPC membership is about $86 a month. And for a concierge medicine doctor, they charge about $2,400 a year for the membership.
Wow. Okay. Well, that's a pretty cool concept. Absolutely. Do you want to share a little bit about what drove you to pursue that? I mean, it's been gaining some traction for a few years now, but I think at least when I was in medical school and residency, we didn't hear anything about it.
Sure. Yeah, I heard about it in 2012. I was driving back from a residency interview in Minneapolis, and I listened to this podcast. It had this really enthusiastic physician who is practicing direct primary care in Kansas. And so I kind of thought it was a really interesting idea. And what blew me away was how passionate he was speaking about it. And then I went to a conference and I saw another doctor talking about direct primary care. And again, he was so passionate and he had said, you can bring so much value to your patients with just your brain and your stethoscope. And it was really inspiring to hear that message, especially when you think of how overly complex our healthcare system is. And it's almost intentionally so. So then in my last year of residency, I actually just wrote a business plan for direct primary care. It's the first business plan I'd ever written. And then I made a road trip. I visited these two doctors out in Colorado and out in Kansas. And I took the best of what they were doing and I brought it back to my practice here in Detroit.
Wow, that is pretty cool. I mean, I think going right in straight out of residency is got to be pretty frightening, I would imagine.
Yeah, yes and no. I mean, we're doctors. We can moonlight in urgent care for 20 hours a week and make a really good living. We can be a supervisor at a nursing home or work with a geriatric population or work with a prison population, or you can work in the ER for 20 hours a week and still make a really good living comparatively. Now, you're not going to make as much as your physician colleagues, but it will be enough to cover your bills, pay your mortgage, pay down your student loan debt. And that's what I did. I just worked in urgent care for 20 hours a week. And then I allowed my direct primary care practice to grow organically. And I'd said, if I can get at least 15 new patients to sign up with me every month, I'll have a great business. And that's what happened. Over the first 3.5 years, we've averaged about 26 net patients. So we've grown by about 26 new patients each month. And that's been super sustainable, and it's allowed me to have this thriving practice. So I don't think there's a lot of fear in it as long as you write a good business plan and you have a nice side stream of income while you're starting up, or you work for a couple of years and build up a war chest of $50K or $100,000 to start your practice with.
Sure. Yeah, that makes a lot of sense. I mean, so the next question I have is a two-part question. So what do you feel the best benefits are, A, for the patients in the DPC model, and then B, for the individual physicians going into it? I'm sure there are many benefits, but what do you think the really big ones are?
Sure. The biggest benefit to my patients here in Detroit is that there's a critical shortage of physicians in the city of Detroit. So for every one doctor, so let's say for every 6,000 people in Detroit, there's only one primary care physician. Now, if you just go north into Oakland County, for every 600 people, there's one primary care physician. So there's a 10x disparity just across a county line between Detroit and Oakland County. And that critical shortage has had patients or people in this community not taking care of themselves, putting off critical healthcare things like getting a pap smear or getting a colonoscopy or having a mammogram, the preventive care things, or just putting off taking care of a diagnosis because there isn't somebody in their neighborhood who can help them with that. So, number one, we're bringing accessible healthcare to our community. The other thing is that people come to our practice and say, I haven't been to a doctor in a year or 3 years or 5 years or 10 years because I didn't know how much it would cost to help me control my high blood pressure or diabetes. So I've just been putting it off. So the second part is we're bringing affordable healthcare to our patients. And then the third part is we're so accessible in that people can call or text us anytime that we offer this form of assurance, not insurance, but assurance, where people can reach out to us and know that we'll be there for them no matter what. And that's been really transformational for our patients. And that level of trust that we've been able to develop has been crucial.
Yeah, that's amazing. I mean, I think I want a DPC doc,
Yeah, for sure, man. Join the party. And that's the thing. There's now, when I first started, there were less than 400 family or direct primary care doctors doing this across the country. Now it's approaching about 1,300. So you've seen a quadrupling of the DPC talent pool over the last 4 years.
Yeah, that's incredible. So what do you think the benefits are for the physician?
Yeah, for doctors, you get to practice medicine on your own terms. And what I mean by that is that you don't have an insurance company telling you what you can and cannot do. You can just practice medicine and deliver care to the best of your ability. Additionally, you have fewer patients. So on average, the typical family medicine doctor has to have 2,400 patients in their panel. And that means they see about 24 patients each day. So you're getting about 20 minutes per patient, and you're probably charting for 10 or 12 of those minutes. So you really have only 8 minutes of face-to-face time with each individual patient. And that's just a crime. We went to medical school to really listen to our patients and take care of them fully. And when you constrain that care to 8 minutes of face time, it really hurts physicians. They feel burnt out and they feel like they can't practice medicine anymore. And we should talk about burnout later. But
Yep.
As a doctor, you now have 30 minutes to an hour to fully listen to your patient, get down to the root of what's bothering them, and take care of them to the best of your ability. And you only have to see 5 to 10 patients each day. And because of the membership, you can make maybe a little bit less, maybe the equivalent, maybe more, depending on your price point. But you can make a really good living as a physician in this type of model.
Yeah, that's really cool. I mean, I think we're going back to the old time family doctor that really knew everything about their patients. I agree. 8 minutes per patient is a crime. And then you wonder why people end up in the ER or in the hospital all the time, because, they can address one item and not, hey, there's this thing that's been bothering me for 3 months or what have you.
Exactly.
Oh, that's,
and I saw that in my residency, where I literally was like, in my first year, I maybe had 20 minutes with the patient. My second year, I had 15 minutes per patient. And then my third year, I felt like I only had 10 minutes with each of my patients. I knew that upon graduation, that would just be ratcheted up one more time, where I'd have even less time with those patients. I just couldn't, it would be unconscionable for me to practice like that.
Yeah, I don't think the people that go into the primary care specialties want to practice that way. I think that not all of them, but many of the family and general internists and pediatricians that I've met in my life have really cared about learning everything about their patients and really being their primary care physician instead of being a funnel towards specialists and what have you. So,
Exactly.
No, that's pretty cool. So I guess on the flip side, people saying, well, hey, are you getting calls like at 2 a.m. every day and on the weekends, or, disrupting your life?
No, I get a handful of calls every month after hours. And maybe I'll come in once every 2 or 3 months after hours or on a weekend to sew up a laceration. But mostly my patients respect me and my time, and they reach out to me between 9 a.m. and 5 p.m. during the day. I kind of, people treat you how you allow them to treat you. So basically, if something comes up and somebody has an urgent thing, they know that they can get a hold of me after hours. But most people have found that I'm super responsive if they text me, between like 8 a.m. and 6 p.m. or 9 to 5. And I get them in right away if they ask for an appointment. And so, it becomes this virtuous cycle where I respect my patients and they respect me. And it becomes this nice, like, two-way street dynamic relationship.
Yeah, no, I would imagine that would be so. I mean, at the heart of it, people, I do believe in the goodness of humanity. I think people will treat you the way they want to be treated as well. So, yeah, that's great. And then, did you find it difficult, like negotiating some of the contracts with the wholesale prices, like you talked about? Was that a hard thing to do?
Not really. The hardest one was with Quest Diagnostics, because they're such a gargantuan institution that to come to them and say, hey, I want some better pricing for my patients and the care that I provide. You're just one doctor with maybe 100 patients when you start that negotiation process. So they don't really care about you and the pricing. So it's kind of like you have to be the squeaky wheel and just consistently email them every week and say, listen, our price on this is bad. Can you help us out with this? And you do that over and over and over again. It's kind of like beating your head into a brick wall. But at the end of it, after 3 months of doing that, we got some really nice prices. we're able to do a complete blood count for $4 and a lipid panel for $6 and a TSH for $6 and, HIV test for $10, et cetera. And so those prices make our service super valuable for our members who engage in our service.
It's incredible to think about just the bloat in the system when you can have a complete blood count for $4 versus what your insurance is being charged and what's getting trickled down to you and your employer. I mean, that's unbelievable.
Exactly. And, our hospital that I worked at in residency, they would charge $125 for a complete blood count. I get it for $4. And the people that really harms financially are low-income folks who fall in the gap between Medicaid coverage and being able to afford private insurance. So here in Michigan, the cutoff for Medicaid is $17,000. So if you make $20,000 or $30,000 as like a truck driver, hairdresser, bartender, you're disqualified for Medicaid, but you can't necessarily afford private insurance. And so those folks, when they get sick, they get hit with the hospital prices without that insurance buffer. So they're on the hook for, thousands of dollars in charges for relatively simple things. And that's who our medical industrial complex really harms the most.
Yeah, I mean, Pete, they'll never pay that debt back, and then they're not in a position to rise in employment or in credit circles because they have that medical debt. Yeah, that's a whole different conversation, I suppose.
But it is a part of my ethos and why I do this, because we're protecting people from those overcharges and from those destructive forces in the healthcare system.
Yeah, I love it. That's great. And your passion rings through. So I think you're doing an awesome thing especially for your community and the low income folks. That's awesome. You mentioned burnout. So let's talk about it a little bit, or whatever you want to call it these days, moral injury or what have you. Sure. Do you see this model as a cure for burnout, or at least to help mitigate it?
Yeah, so I definitely see that. In my first book, you said the word cure. So my first book, I called it Direct Primary Care, The Cure for a Broken Healthcare System. And in the book, I talk about burnout in these terms as let's say you're in your house and then half of the light bulbs go out at the same time. You wouldn't say, man, half of my light bulbs in my house are dysfunctional. They should do yoga and meditate to heal themselves. You'd say, no, there's something really dysfunctional about the electrical wiring in my house, and I need to call an electrician and have them fix the main panel so that this doesn't happen again. But in healthcare, when 50% of doctors are burning out, we just tell them to do guided meditation and yoga and go on retreats and help and put it on the doctor to fix themselves. Doctor, heal thyself. But we never really take a look at these greater systems within the healthcare system of why 50% of the doctors are burning out within that system.
Yeah, I mean, listen, you just got to be more resilient. That's it.
Yeah, exactly. Okay? What's wrong with you? Be more resilient.
I focus on early career docs, and we're seeing the largest exodus of early career physicians in the history of time, which scares me for my future, right? Because who's going to take care of you and I when we're old? I guess people like you, but it's scary, and we're doing nothing about it. And at least the healthcare systems are doing nothing about it. I agree with you in that front. I mean, a lot of some of the clients that I work with, I want them to stay in medicine. I don't want them to leave medicine because they did all this work to become a doctor, and they don't hate being a doctor per se. They hate being a doctor in the current system most of the time.
Exactly, because you're basically told how many patients you must see, and you're told what EMR system you must use and how many referrals you must make and how many MRIs you must order in order to create the kind of downstream revenue that's going to justify your paycheck. The average physician across the country, family doctor, makes about $240,000 a year. Let's just say average. Some earn more in rural communities, or some earn less in urban communities, or whatever. But 240 is a number. the average family doctor creates about $2.1 million in downstream revenue when they're affiliated with a larger hospital system. And that's from all of those referrals and tests and imaging studies, et cetera. And so I think doctors really need to be cognizant of their own value and take control of their own value to create their own practices and their own wealth outside of those destructive hospital systems.
I agree. I've said it before on the show that we were taught, at least I was taught going through medical school, that private practice is dying or dead. And I would modify that the old way of private practice probably is, but new and innovative models like your own, and people that are, not just making a practice and expecting people to come, but are utilizing social media and other marketing tools that we haven't in the past, to bring organic marketing, like you were talking about. That's the future. I don't think these giant conglomerates are the future of medicine as much as they want to be.
Yeah, I agree. I think that, if we want to retake medicine, we'll have to innovate our way out of this bad position. And it's going to start from doctors and their patients and delivering the type of service that patients want to receive, and doing that in a truly patient-centered way. And I think that's where we can be successful.
I agree. So let's say you're a third-year resident and you're contemplating your job moves, and you heard about this DPC thing. What would you recommend to residents and their beginning of their journey?
Well, definitely just educate yourself about direct primary care. And there are a lot of good resources out there. Shameless plug, I just finished a book on this topic called Startup DPC, How to Start and Grow Your Direct Primary Care Practice. And that's accompanied by a website I have online as well, startupdpc.com. And, within those two resources, you'll find courses, blog content, engaging material that can help to inspire and teach you to do this on your own. It's not difficult as long as you take the right steps to get it done. And I really lay it out in both the book and my online courses to get doctors out of this bad position of being employed by these gargantuan hospital systems.
Awesome, yeah.
Beyond that, meet up with us at the direct primary care conferences. We've had a blip this year not being able to gather because of COVID-19, but 2021, I fully anticipate getting together with everyone again and really teaching people and inspiring people in those formats to go out on their own and be their own physician, be their own boss in this type of environment.
Great. I will put links to all that in the show notes for the listeners. So about you some more. So what do you like to do for fun?
I play soccer. I play soccer Tuesday nights. I run basically every day. Every morning I'll get up and run. I love to travel, which has been difficult this year. I usually go on 2 or 3 trips every year, just somewhere, a couple of short trips and a long trip to see something new and be inspired and engage with my different senses and see different things. And then I like going out to restaurants with my wife. She and I like to try different things. And we also have 3 dachshunds. So we're a dachshund family at this point.
That's great. Yeah, I like all those things except running. So, I think I saw a meme yesterday that was like, do you miss travel? And then the picture was a guy just hanging on the top of an airplane, basically.
Yeah.
It's we'll get back there. We'll get there.
Yeah. I hope we can do it in early 2021. But I don't know. It's not looking good right now.
I know it. Well, we'll see what the future brings, I suppose. Besides your own books, do you have a book recommendation for the listener?
Yeah, if you are looking to start your own practice and, gain new followers, I love reading books by Gary Vaynerchuk. He wrote a great one called Crush It, which I absolutely love. He just talks about how to engage with people online in a beneficial way. And then I also love Grant Cardone. A lot of his books like 10X Rule, If You're Not First, You're Last, etc. Those are really inspiring and teach a lot about sales and marketing. And I guess that's why I'm attracted to those books so much, is because I literally had zero sales, branding, marketing training in medical school or residency. So I really loved reading those because it felt like it struck a chord with me. And it was kind of like a missing piece to my approach.
Yeah, I agree. Gary V is an animal. I mean, that guy doesn't stop. And then Greg Cart, Sell or Be Sold, I read like a month ago. And, you just get so pumped up by reading that guy's
writing. You're like, I can do anything. Anything is possible. Let's go.
I know, it's great. And I think for some reason, docs view sales as like some like gross, icky thing. And that's not what it needs to be. It's providing value. That's all it is.
Yeah. And this is what I tell doctors in my book, in my courses. Marketing is your character plus communication. And so doctors have great character. They are, they work really hard. They put in the 36-hour call. They did 4 years of medical school, 3 years of residency, a ton of sacrifice in there. And all they need to do is communicate their character with their audience, and people will be attracted to that character. And marketing is that, character plus communication piece, where you go on social media and you tell a story about how you helped somebody, or you tell a story about how staying up 36 hours helped you take the best care of one of your patients, or the things you sacrificed during residency to deliver optimal care for your patients. And that resonates with people, and they see your character shine through, and they'll be attracted to you and your practice.
I agree. That's great advice. So people want to find you or find out more about you. Can you give us some links for where we can get you?
For sure. PlumHealthDPC.com is the site for my medical service here in Detroit. And then on Instagram and Twitter, I'm at Plum Health DPC. And then if you're a doctor looking to start your own direct primary care practice, check out our book on Amazon, Startup DPC, or our website, startupdpc.com.
Great. Well, thank you again. Do you have any parting words or thoughts for the early career physician other than all the insight you've given us thus far?
Yeah, one of the things I live by in this practice model is it's not the decisions, it's the decisiveness. So, a lot of doctors want to make the perfect decision, but if you go into business, if you wait for that perfect decision, an opportunity is probably passed you by. So when you're like 70% sure, make that decision and move on. And a lot of doctors get stuck in the analysis paralysis, leave no stone unturned. And that's fine when you're taking care of your patients. But when you're starting a business, you really need to make quick decisions and move on.
Yeah, that's awesome. Failing forward always, right? Doesn't matter.
Exactly.
That's great. Okay. Well, thank you so much, Dr. Thomas, for coming on the show. I really learned a lot, actually, and I got to go find me a DPC doc. But it's been a lot of fun, and keep doing what you're doing out there. You're a great service to your community.
Well, thank you so much, Andrew. And thanks everybody for listening, and good luck with your journey.
Wow, guys, that was a fun show with Dr. Paul Thomas. I really did not know that much about DPC. I knew what it was in theory, but he really takes it to a whole new level. And I really wish there was a DPC office here in Buffalo. I'll keep waiting. So Dr. Thomas really described what DPC is and how it's beneficial to patients and physicians alike. He also talked a little bit about wholesale pricing on labs and how to get started fresh out of residency or later in your career. That is all we have for today, guys, but thank you so much again for listening. Please remember to leave me an honest rating and review on Apple Podcasts because it really helps get the show out there. If you'd like some direct help in regards to career transition, career strategy, or any other services I can provide, please find me on social media or on my website, andrewtisserdo.com, and reach out. Let's see if I can help. Otherwise, guys, until next time, keep talking. All opinions expressed by the guest in this episode are solely the guest's opinions and do not reflect the opinions of Andrew Tisser DO, Talk to Me Doc LLC, or any affiliates thereof. The guest's opinions are based upon information he or she considers reliable, but Andrew Tisser DO, Talk to Me Doc LLC, nor any affiliates thereof warrant its completeness or accuracy. The guest, Andrew Tisser DO, Talk to Me Doc LLC, or any affiliates thereof are not under any obligation to update or correct any information provided in this episode. The guest statements and opinions are subject to change without notice.